Hey guys, welcome back to the Gut Girls podcast. We are so excited to have you on today. Remember, if you are listening and if you've listened to some of our past podcasts and you like the information, please subscribe to our channels to help get the information out there to others. We are so thankful for that in advance. So today, guys, we're talking all about inflammation. And we're talking about this because we know that you guys are Googling it because we're getting the questions in our Gut Girls membership, through podcast feedback. People want to know about inflammation. And so kind of what we're hearing, Dan and I this is how people are saying it to us. They're saying, how do I know if my body's inflamed? Or gosh, does inflammation cause bloating, weight gain? Is this why I'm having these symptoms? What about my anxiety? Is that linked to inflammation? What about my brain fog? Is that linked to inflammation? And so they're curious. And so if you guys are listening, we're gonna answer these questions today. We're gonna help you understand, really the root of some of these like inflammatory responses. When is a time to kind of work to support them? When is a time to kind of let the body do its job? Remember, the body knows what it's doing. So how can you support the natural inflammatory processes? And so I'm going to let Dana kind of start here with, Dana, you've had a recent experience with your daughter, one of your daughters with inflammation. I think that's also what brought up this question in our Gut Girls membership as well. So let's dive into that so people can really get an idea of what this looks like in real life.
Yeah, because people do come to us all the time like, I have inflammation, so what actually is it? And so acute inflammation is exactly what you were just talking about. Something like with Michaela, where she has an injury, somebody comes at her from behind and while she's playing basketball, and immediately, there's swelling when she goes down on her knee like that. So there's redness, there's warmth to it, there's obviously pain. And so the same thing happens if you step off a sidewalk and you roll your ankle or whatever it is. So that's what that acute inflammation is. That's our body's design where, there's a whole process that happens with that where, the platelets really try to come to the, to that injury and replicate and all the different things, but what we're talking about more is chronic inflammation, and that can be like a little bit less obvious, right? So sometimes people associate it with all the different symptoms, like, sometimes brain fog, joint discomfort, where it's not necessarily like an actual injury, like what Michaela experienced. Sometimes it's, a lot of times we see it in skin. So, even if we kind of go back to my original time that I sort of met with you, I was very inflamed. In fact, I'm kind of looking, if you're not looking at me, I'm kind of like using my hands on my face where I felt like I had a constant butterfly rash. So I was like diagnosing myself with, some sort of inflammatory response or some sort of, I had looked up lupus even, right? Because I was thinking, so that was that inflammation coming out in my skin. And so but all of these symptoms, all these things that you're constantly kind of chasing, trying to figure it out, it's not the diagnosis. That's just your body's response to something going on the inside.
Yeah. And I think that's huge to kind of like just separate for a second. Of a lot of people will end there like, oh, I'm inflamed. That's what's wrong with me. And then they go right to like, okay, what's the fastest way to get rid of it? Like, I don't like it. Like you at that time with I don't want this on my face, all that. How do I get rid of it? And the question, it makes sense when you're symptomatic, you're in pain, you're hurting, maybe you're embarrassed of the skin, rashes on the face, but we want to shift that language, right? To, hey, how do I just get rid of this inflammation as fast as possible, to helping the body create an appropriate response that then will successfully resolve the inflammation. Okay, so let's even break this down a little bit more. Let's go to Michaela again, for example, when she hurts her knee, the initial inflammatory response, guys, that's what we're talking about. Like Jenna said, it brings that immune cell and repair to the area. But if we move too fast past that, like if Diana, in that moment, you guys were just pounding Michaela with anti-inflammatories, her tissue is not actually going to respond correctly, because we need that inflammatory response in acute injury. It's healthy, right? And so we need it to happen. We don't want to just jump to, NSAIDs and anti-inflammatories. I think of like even in the chiropractic world, when someone comes in with an injury, we don't want to just shut that down right away. We want to give it time for the body to actually rebuild and remold tissue. That's what happens in the inflammatory, like as a part of that inflammatory cascade, your body does rebuild and remodel that tissue appropriately. So then that chronic thing that you're talking about is, gosh, okay, I've got this low grade inflammatory puffiness to me. How do I take this signal that my body is telling me, and maybe through journal, like, gosh, Dana, you and I talk about journaling all the time. How does that, if I'm journaling my daily intake of food, if I'm journaling, my lifestyle choices, am I waking up after a night of drinking or a day of too much caffeine and not enough hydration? Am I waking up to this chronic low level puffiness or rashes or hives? I even know a lot of women that around their cycle develop hives. I mean, for real, it's not just one or two people out there. This is like a chronic, every month you have this inflammatory response, right? That is a response to the uterus lining breaking down and shedding. So then the question is, do I just pop NSAIDs every month because I'm in pain and I'm bloated and my hives are there? Or do I work to provide my body every month with better tools on responding to this natural inflammatory response? A cycle is a natural response, but it does come with some tearing of tissue. And so, yeah, it's going to have an inflammation, involved. I'm doing that in air quotes. There's going to be an inflammatory response involved in that. So I just want people to understand, like, it is every day we're dealing with these inflammatory responses, and some of them are brought on by nature. Like our body goes through it naturally. So what's the difference between that acute and chronic, and how do we support a more, daily response to that inflammation? Right, Diana?
Yeah. And so I guess that's a good segue into kind of when you talk about this daily inflammation, you hit on it at first where you're talking about a night of drinking, too much caffeine, so what does that mean? We're correlating food, right? So most of the time, and again, even with me, when we didn't have this massive influx of information through, through Instagram and whatever at this point, or at the point that I started working with you in 2017, we didn't have all this information, but I did already start connecting it to foods. And that is when I wasn't necessarily writing it down as a journal, but I remember like eating some chips and thinking, oh man, like did that make my face worse? And so I started connecting it to it. And, we have people that come to us where they're like, it's dairy, it's gluten, it's carbohydrates, it's this, it's that, it's eggs, it's chicken. I mean, literally we've heard everything. I mean, we've talked about Sarah before on here, where she's one of our clients that's been with us for a really long time, one of our members, and she was like, I could only eat 10 foods. So she knew that the 11th and the 12th and the 13th food that she was eating was causing this massive inflammatory response. But when it really comes down to it, you have, when our members come to us with IBS and IBD and all the different things, it really comes down to what is actually going on inside the gut that's not allowing our body to digest these foods the correct way. What's going on during the flare? And so that's where a lot of times we like to use the GI map test, because sometimes it's the fermentation that's happening. It's the indigestion where our body literally is not producing the enzymes that we need to break down the foods that we're eating. So it's causing this inflammatory response. And obviously it's more complicated than that. I'm simplifying it. But like, what's actually going on at the root of it that causes this additional inflammatory response?
Yeah. And, as you talk about the GI map, I like to point out like something that we look at differently in the Gut Girls when we're supporting our clients is we look at their capacity. So Diana, when we go back to your story where you were in life, you just had your babies, you just lost your mom, there was already a lot that was depleted physically, emotionally, and mentally. So your capacity to respond to inflammation was a lot different than, let's say, someone in their, maybe mid-20s who's just focusing on a career at that point, right? Like hasn't really had a loss, hasn't had, dealt with pregnancy yet and all of that. So the capacities are different. And then think of, gosh, if you guys take our quiz, which, we'll talk about probably in another podcast, but our gut story quiz, we've got client Judy, who, her transformation, she's an older woman with some depletion just from, her age, her years on earth. And, her capacity at an older age is different to respond to inflammation. Her turnover rate to respond to inflammation is different. So we take these women and we educate them about, okay, your capacity is different than this person. So when this inflammation happens, that's where one woman might have to be 90-10, meaning they're eating 90%, according to their gut, 10% living, with holidays and vacations and all of that happening. Or someone's like, hey, I can get away with 70-30, you know what I mean? Like, I don't have to be as strict because I've got more capacity. And so we really get to teach these women the differences in, yes, there's inflammation, and you might, be diagnosed with a inflammatory diagnosis, like you said, IBS, IBD, celiacs, lupus, thyroid, all that. But it's getting to understand your body, your capacity. What do you have on board to respond to that inflammation? What don't you have on board? Like you said, Diana, the GI map reveals that stomach acid, the capacity of the pancreas, the liver gallbladder connection, the immune system, like it reveals all that. And so it allows us to take this inflammatory pathway and make it more personable, which is what everyone is actually Googling. Let's be honest. When everyone is Googling about inflammation and is it linked to this? Is it linked to this? How do I get rid of it? You're looking for a personable answer that, I'm sorry, Dr. Google just cannot give you until you take the deeper dive. And so that does bring me a little bit, Diana, to we usually talk about like how inflammation also affects the brain. And a lot of women, you had mentioned brain fog. They come to us with this symptom. And speak to me for a minute on like what we see, how it's truly not just, the inflammation itself. I mean, the inflammation is a part of it, but even for you, like you had this pattern in the GI map of like gut lacking, like you were missing a lot of good bacteria. And so speak for a minute of how that can really bring forward of this like brain fog that women, associate with inflammation.
I mean, one of the things that during this process that you're talking about that I went through with you, it was the deeper questions that you were asking me. So when you talk about, how that affected my brain fog, I mean, literally, I remember not being able to think when I went from one room to the other, and you're like, do I have dementia? I mean, honestly, I know I kind of giggle at it because at the time I was, in my early 30s. And I was like, what in the world is wrong with me? So when you start thinking through all of those things, you start, like you said, Googling everything and diagnosing yourself with everything. And so when I love that when I came to you, you started asking the deeper questions that really should have been asked probably when I went through what I call the cycle of trial and error, where I wasn't getting asked the questions when I was going from physician to specialist to specialist to specialist. I wasn't getting asked like, well, are you bloated? How's your digestion? What does your stools look like? I mean, honestly, they weren't even asking me, and I'm just going to be straightforward. They're not asking me the questions like, are you pooping every day? If they would have asked me that, I would have been like, no, like once every 3 to 4 or 5 days. My gosh, the toxic load. No wonder the brain fog was horrible. No wonder I felt horrible, right?
Yeah. Well, and go back like even a step further as I'm listening to you, it's like asking about what you were eating because there's a big correlation. Think about how many women will go on a ketogenic diet because they Google their diet and it's like carbs are bad or, Diana, I'm sure at that time you were probably eating a much higher carbohydrate diet than you are today. And guys, carbs are not bad, but it's learning which carbohydrates your body does break down. And Diana, just speak for a quick second on that huge eye opener for you because you have carbs in your diet today. But what does that look like compared to what it did then?
Mostly the types of carbs, of
Yeah.
course, but honestly, the timing of the carbs. And that's
Mhm.
one of the things that I love in our membership, where we kind of go a little bit deeper. And I'm not constantly just trying to sell the membership. Obviously, we want you to be a member, but we do get to have the deeper conversation with our members that, they're like, hey, this is when I work out, this is what I'm eating. And so then we can help them figure out when to time those carbs out a little bit better to utilize them for energy, like what they're supposed to be. And so, like you said, it's not that carbs are bad. We both definitely still have carbs in our diet. It's just we time them out a little better. And I will say I don't eat as many on the days that I'm not having a deeper, more intense exercise. I don't eat as many carbs. Now, I want to be clear, I do not count my carbs. So it's just sort of this mental journaling, and it's not perfect, guys. I mean, I'm not walking out there looking like some kind of fitness model or anything. I've told you before that I eat for my gut. And so we're not trying to take this into a carb, like truly a carb podcast or anything like that. But what I realized is that because the timing was off, because the amount was off, the portions were off, I wasn't utilizing them correctly, that was making things worse for my inflammation. So if we bring this kind of back full circle, that's what it came down to, is my gut actually couldn't handle that. And we saw that when we ran the GI map test. So it was like, okay, so now what, Diana? What do you need to do now? It's not cut carbs out, but let's utilize them better. And maybe you need to take a specific digestive enzyme because your body's not literally breaking those down.
Well, and think about the liquid carbs for just a hot second, because Dana, I still remember, because I don't think I realized this to a couple podcasts ago, that you were waking up and drinking is it a Diet Dr. Pepper or a Dr. Pepper, or what were you drinking?
Diet Coke every morning.
So you were waking up, starting your day with a Diet Coke. Guys, right there, again, we're just pointing out, like, starting the day with a huge inflammatory carbohydrate drink, like literally terrible in every shape and form. And so it was like, okay, that's what we're talking about. When we get to really talk about how are you starting your day? How are you ending your day? How are you, putting these carbs in around your exercise? Gosh, are you exercising? These are the conversations, along with are you pooping and all that you should be having with a clinician when you are trying to figure out your inflammatory process. And so then that kind of segues into what kind of information is solid information about how to support this process. Because if I love your story, Dana, because it always continues to speak to me, but you were told, hey, just take NSAIDs the rest of your life for this. And so if you're told that, guys, please don't stop there. Like that's just not doing you. I don't even know how to say in a sentence. It's just not doing you any good. It's not giving you any validation. It's not speaking to the root of it. It's actually just a Band-Aid that's going to cause another problem down the road. It is going to eat away at your good bacteria and your stomach acid over time. So Diana, let's talk to them just briefly about maybe some other options that are out there that we share in our membership with our clients.
Mm-hmm. Yeah. And obviously we talk a little bit, we talk a lot about the diet, the nutrition side of it, of course, but then there are times that we use supplementation for this. And so, my mind immediately goes to turmeric, boswellia, omega-3s. There's so many different good supplements, and that is one of the things, again, that we sort of do in our membership. Even if you just want to come in for $15, we really try to help you learn how to drive the inflammation down really quickly. So, we want you to feel 25% better just within a week or two, right? And it happens a lot. So,
oh my gosh, I'll interrupt you there for just a second, just to share. We had a client actually just this week that told us she didn't even start a supplement. So listen to this one, girls. She didn't even start a supplement. What she simply did was she used to work out her entire lunch period, and she would jump right back into work, and she would eat in front of her computer, and she was having abdominal discomfort, and that's a sign of inflammation, right? You go to any doctor, they're going to say, yeah, your gut is inflamed. All she did was took that workout time, dropped it down a little bit. So she was working out not as much. And that gave her time to actually sit and eat lunch before jumping back into work. She even sent us a message that said, I even took some time to socialize in the break room with some other people. And just that, her stomach pain has gone away. And so that's, I mean, I think that's what we're saying is like, yes, there's supplementation, the turmeric, the boswellia, the omegas. Guys, these are listed in our core 4 when you join us as a gut girl and our tier 1 membership. But we get to actually look at your day, right, Diana? Like we get to have that phone call and look at your day and be like, you're also driving the inflammatory pathway by these lifestyle choices. And I mean, guys, it doesn't get more personable. Now, you're not going to find that in a 15-minute doctor's appointment. You're just not.
Yeah. And I mean, we're not trying to necessarily like override the inflammatory response, but we try to help you drive that down a little bit so that we can sort of open up the window to the opportunity for your body to heal itself. And so I love the idea of us doing that right up front where we talk about nutrition. We get to talk them through some of those core 4 supplements and why we do them, how we do them, when do we take them, all of that. And so I think that is so cool. As a part of one of the things that you and I have talked about so many times over the years is not everybody needs to jump in immediately to the GI map test. And so we created the first part of this membership is to a lot of our listeners that really just need to start with those core things, the core nutrition, the core supplements, right? And drive down that inflammation. And within a couple of weeks, they might be like, gosh, I'm 30, 40, 50% better. And so I don't even feel like I need to, maybe right now is not the time that I'm ready to dive into doing a GI map test. We want you to do that foundational work anyways. And so that's one thing that we're super proud of, guys. If you have not been to our new website, it's still gutgirls.health, but it has been totally revamped. And we would love, just like Angela said, if you have shared and liked our page and, this podcast, we really appreciate it. We would also appreciate you sharing our website because we do try to provide a lot of information there now of how you can work with us. And so you'll notice that just like I was talking about with the membership, that we call it our tier 1. It's a self-starter, but it has a massive amount of information and resources that can be so helpful for you. And we would love for you to join us in that. You get a taste of what it's like to be a Gut Girls member and make your decision whether or not you want to go forward with doing the GI map test, or you may not, and that's perfectly fine. So you can do that by going to our website, gutgirls.health. Angela, anything else that we want to mention about that?
Well, and just in that membership, guys, if you are someone who's trying to support your natural inflammatory responses, let's say with something like omegas, you get a 15% discount on that supplementation. So, I mean, it is going to pay for itself, really. And so we're excited for you guys to get started. And we encourage you to jump to the website and check it out. And you can always, through the tier 1, you do have access to our, our chat, like our GroupMe chat community. And guys, there is just so much information in that, that community that you get to share with other women. And so if you are tired of doing this alone, tired of just you and Dr. Google figuring out your inflammatory response, join us in tier 1, and we can't wait to see you there.
The Gut Girls podcast is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. We are not acting as licensed medical professionals. Always consult your doctor before making any changes to your health routine.